Next speaker is Dr. Rashmita Ravishankar.
A very good morning to the dignitaries and my colleagues and friends. I'm going to be presenting the learnings from a 17-year-old eye bank from a tertiary eye care center in South India. Our eye bank was inaugurated in the year 2006 with support from the National Rural Health Mission and an active involvement from the government. So the very first lesson we learned here was that involvement of the government has ensured efficient functioning and growth of our eye bank. Looking at the trend of our eye bank over the years, we started with a meager collection, and then with the initiation of HCRP in the year 2010, our collections really skyrocketed, and this trend continued up until the year 2020 when we were hit with the COVID-19 lockdown. But we have since then showed a good recovery. So the initiation of the HCRP helped to tremendously increase the collection single-handedly. And every year during the National Eye Donation Fortnight, we hold awareness exhibitions and pledging stations. We also organize awareness rallies and innovative methods like flash mobs at public places like the malls with a dedicated pledging station. And every year we hold donor meets to encourage, motivate, and felicitate the family of the volunteers and the donors. And we have a very active social media presence where we hope to motivate and validate the contributions of our counselors and volunteers every month. And we've learned that the continuous and innovative ways of community engagement and motivation to be catalysts in this process of eliminating blindness has helped increase the efficiency of our eye bank. We are continually engaged in research, and to use it to our advantage, we've learned that NGOs play a vital role in encouraging voluntary eye donations, which are important as well. And a targeted education and motivation of the younger population is needed to increase voluntary donations. We also conducted a study to assess the knowledge, attitude, and practice among ambulance drivers and freezer box workers towards eye donation. And on analyzing our results and using it to our advantage, we arranged an awareness session among these community grief counselors to enhance voluntary eye donations. So drawing from the role of NGOs, we came up with the concept of community grief counselors, where non-medical workers from the community could help in motivating voluntary eye donations. But our greatest strength perhaps lies in identifying our biggest weaknesses. And despite a healthy collection rate, our utilization rates have stayed at around 30% of our collections. And we identified and analyzed the reasons for non-utilization and tackled them one by one. And by introducing the in-situ procurement method, we were able to deal with the issue of collapsed globes and damaged corneas. And this has also significantly decreased our processing time. And if on rare occasions we are unable to collect a blood sample, or if the cause of death is a contraindication, the whole globe is enucleated. And in this way, we have tackled two issues at once, and also saved the storage media wastage, prevented storage media wastage, and increased the tissue eyeballs available for surgical training. We also are involved in targeted training of our doctors to ensure optimal tissue utilization. And during the COVID-19 crisis, the cornea collections, as you all know, hit an all-time low. And then we started preserving these corneas in glycerine, and thereby we were able to use these for emergency therapeutic and tectonic purposes by increasing their shelf life. We are also involved in brainstorming sessions, and we are working at an infrared-based vein finder and a portable centrifuge with hopes to eliminate the conundrum of lysed blood samples. To consolidate, these are our findings and of our results, and we hope to use these ourselves and propagate it to other eye banks, especially government involvement, HCRP to boost collections, actively involving in research and modifying eye bank strategies to help increase the efficiency. And perhaps the biggest learning we've had is from the crisis of COVID-19 that has helped us increase our utilization as well. And soon we hope to see more dark blue hues on this map of India. Thank you.
Thank you, nicely done. So anything extra you've done for the corneal donation to increase the corneal donation in your center?
So then, particularly in our center, whenever a patient comes with a corneal blindness, we have a dedicated counselor who talks to the patient as well as the counselor, and sort of I think they are more sensitive to this issue of corneal blindness, and they are the targets we have to motivate, and we even encourage the attender of the patients to pledge their eyes and inform that just pledging the eyes is not enough. Your family has to give consent for your cornea to be retrieved. So to propagate this message in the community through the patients who come to us.
Okay, thanks. So probably, our center, we have started the WhatsApp anybody was come, we got short video of WhatsApp for 20 seconds and followed by question and answer whether you want to do the corneal donation or not, followed by second visit for pledging.
We have these
So,
little activities
yeah.
planned during the iDonation fortnight as well. To, I mean, yes, it would be better if we could continually do it throughout the year and rather than just a particular fortnight.
Thank you, Dr. Rashmita.
Thank
The next speaker is Dr. Naren Shetty.